Test 1, 2, 3. Lucy, you ready?
Yep.
Well, good afternoon. I hope everybody found their lunches and everything else. The next speaker is kind of special, especially to me, because she's my much older sister by a whole minute. We're twins. And of course, she's a minute older and I look 10 years older too. But that's beside the point. Suzanne has been in the International Academy of Hydrocolon Therapy as an officer for many years. She's been a hydrocolon therapist, an educator, and a great little sister. And so without delay, I'd just like to introduce my twin sister, older sister, Suzanne Margolis Gray.
Can you hear me okay?
No.
Is that all right?
No.
No.
No? I gotta use this thing? Okay. Better? Can you hear me now?
You gotta talk
Have your right to my mouth. Just like this? Okay. Anthony. My brother bit me on the ass, and that's why I came out first, and that's why I'm a colon therapist and he's a dentist. So, anyhow, I thought that was really good. Anyway, so, Mike actually had his first colonic by myself, which people said, oh my gosh, how could your brother go to you for a colonic? And I'm like, well, you know, we spent all this time in the womb together, so what difference does it make? We were roommates, exactly. So, today, I'm going to talk about the opposite end of the body, what you're most accustomed to is the mouth, but we have to go through the mouth to get to the bottom. So what we're going to do today is we're just going to go briefly through the anatomy, and then we'll get down to the nitty-gritty of the large intestine and the colon hydrotherapy, etc. So when we talk about colon hydrotherapy, it's part of the digestive system, and it's really important for good health. And I found this quote that I thought was really hit it right nail on the nose there. And that is, the digestive system is like the roots of a tree. When the roots are strong, the tree is generally strong as well. When the roots are diseased, the whole tree is affected. Nutrition, digestion, absorption, bacterial balance, and intestinal permeability all play significant and independent roles in the health and gastrointestinal tract, the health of the body. This is where it's at. We've talked about the toxins, Boyd and Haley talked about the mercury, but if we don't get it out of our body and it sits in our colon, we can be reabsorbing it. And one of the most important things is that we can take the colon and look at it as our plumbing. And the most important house that we have, our bodies. So you know what happens when your plumbing goes array with the
Just pause there. It's the projector, not the computer.
not going to have to be in therapy with that. So I'm going to continue on. He'll catch up with me. He's known to do that. So anyway, where was I? Our house. Your own house, when your plumbing is bad, what happens? It backs up. Well, the same thing with our house of our body. So today, and you can follow this in your book, because I'm pretty, exact on the booklet there. So what I'm going to be sharing with you today is what is good digestion, what is impaired digestion, how do metals affect the digestive system, as well as toxins. What is a toxic stress cycle? What is colon therapy? Why use colon therapy? And what is a good bowel movement? Now, I know that you're all very curious about that, especially after lunch. You want to know what comes out of you and what's good and what's not good. Well, we're going to find out later on. So as we go on, the digestive system, starts in the mouth, then to the esophagus, to the stomach, small intestine, large intestine, and out of the body. So let's talk about this digestive system. It's 30 feet long. It's pretty long when you think about it. And for instance, like the small intestine is 23 feet long. Ladies, think about it when we have children. I mean, there's a lot of things that are crammed inside our abdomen. So it's a very long, long tube, and it has different musculature movements to get the food down. We have accessory organs, the teeth, the salivary glands, liver, gallbladder, and pancreas. And these accessory organs are really important to the digestive tract because it supports it. Can you imagine if we didn't have teeth? Especially because you're a dentist, you understand that. So, and it takes a while for our digestive system to pass the food all the way through. I don't know how God did it. He gave the animals the easy way out. They eat food and they just have bowel movements like that. We sometimes go 13 hours, 4 hours. We have some people that actually don't even move their bowels for days. And I'll share some of that with you later. So what we're going to talk about now is the functions of the digestive system. And what are the functions? It's to produce and secrete enzymes that prepare the food for absorption. That's where I'm at. It moves the food through the digestive tract, and it absorbs what has been broken down into the body, and of course, to leave the body. And 70 to 80% of our immune system is connected to our digestive tract. So we're going to go ahead and take a short little journey through our digestive system, and it starts in the mouth. We have the salivary glands, the sublingual, submandibular, and the parotoid. Now, amylase is produced in the parotoid salivary gland, and it's really important because we eat a lot of carbohydrates, and so this is the first step of digestion for carbohydrates. And it's really important that we chew our food. I tell my clients to chew their food 30 to 50 times. They look at me like I'm totally nuts, but for those of you that, after the holidays and you want to lose weight, believe me, your jaws will get tired of chewing and you won't eat that much. The other thing too is that it gives the saliva, the enzyme, and the food to interact with one another so you have the complete digestion that takes place. So then you have the voice that will now go down the esophagus. Now the esophagus is the pathway to the stomach, and it has wave-like contractions called peristalsis. It doesn't have a mucus lining, but at the distal part of the esophagus is a lower esophageal sphincter. And this lower esophageal sphincter is triggered by the hydrochloric acid that's in the stomach. So if you have low hydrochloric acid in the stomach, then there's a good possibility that you may have acid reflux. What we recommend for our clients is that they take enzymes with hydrochloric acid to support that. And this is that gatekeeper.
I took my projector upstairs. Can somebody call AV? Keep going through your notes.
Okay, I'll just go. So the other thing too that, and being dentists, what's really important is that you have the bacteria, periodontal disease, and also those cavitations. You need to have that hydrochloric acid because Barry Marshall, who was a Nobel Prize winner, that realized that stomach ulcers were not caused by stress, but by H. pylori. And we swallow 2 to 3 quarts of saliva a day, and you have H. pylori in your mouth, which can be passed through your saliva and feces. So if you're swallowing that and you don't have enough hydrochloric acid in the stomach, you can't develop an ulcer. So the stomach has 2 main functions. It's a holding tank. It can hold up to 2 to 3 cups. It's really interesting because I found that over my years of reading different books on anatomy and physiology, I found that you'll get one person saying, well, no, your stomach can hold only 3 cups. I read a book a few weeks ago that said it can hold up to a gallon. And you imagine one of those gallon containers of water, and you see somebody with a big gut, well, I guess they might have a gallon of food in there, I don't know. So because there sometimes are discrepancies.
Sorry, sis.
I know there was such beautiful slides and color and everything.
So the gastric juices, like in the stomach, you have the mucus to protect the lining of the stomach because of the hydrochloric acid, this acid environment, which is pH of 2. And it has over 35 digestive glands in it. And so it's really important, again, for the hydrochloric acid because it also will kill bacteria and the parasites that are there. At the pyloric notch, which is at the lower aspect of the stomach, you have gastrin. And gastrin helps to regulate that acid production. Now the hydrochloric acid will also meet up with the pepsinogen, which activates that to produce pepsin. Pepsin will take those long chains of protein and help to break it down to shorter chains that when it gets into the small intestine, it will be better absorbed. For the next slide, we're going to the small intestines. Now the small intestines is where most of your absorption of nutrition takes place. It's approximately 23 feet long, and it has 3 sections. The duodenum, which primarily absorbs minerals. The jejunum, which absorbs water-soluble vitamins, carbohydrates, and peptides. The ileum, which absorbs fat-soluble vitamins, fats, cholesterol, and bile salts. Now, in the small intestine, you have microvilli. These are finger-like projections. And on top of that, you've got the microvilli on top of that. Right.
I know, she's on her way.
So what happens in the small intestine is that it's supposed to be semi-permeable, which means it's very selective in what it's going to have to pass through to go into the bloodstream. So it's like these invisible cops that are out there, and they're saying, oh, here's a digestive nutrient, I'm going to grab that and let it go into the bloodstream. Oh, there's another digestive nutrient, I'm going to let that go into the bloodstream. This one is not digested, we're going to go ahead and pass that down. We're going to send it to the large intestine. But what happens when our small intestine is not working right, or even our accessory organs? Then we have breakdown, and we have something called leaky gut. And that's when everything is absorbed and goes into the bloodstream.
Oh, thank you. Okay, mine's on his way with his, so just keep going.
Okay, so one of the things where we have the small intestine and the stomach coming out, I call this the DA junction, and that stands for digestion and accessory organs. I made that up, and anybody wants to coin it, go right ahead. But it's a really important part in the digestive system because here you have the liver, you've got the gallbladder, and the pancreas coming together to produce the fluids that are necessary for good digestion. The liver is our main detoxification organ. It has over 300 functions to it. It produces the bile and actually is a very good indicator of what your health really is. And there's a strong connection with the liver to the colon. If you have a happy colon, you're going to have a happy liver. Our gallbladder will take the bile from the liver and it will concentrate it. And we have approximately a quart of bile that's produced daily. It also emulsifies fat, and it helps to lubricate the bile as it goes through the intestinal tract, and it helps with the color for the colon. And I'll share with you different colors of the colon as we go on. The pancreas secretes 3 digestive enzymes: protease for protein, lipase for fats, and amylase for carbohydrates. Now what will happen is that the common bile duct will have the bile coming up, which will meet with the pancreas, and then at the sphincter odi, this is where it enters into the small intestine. And this is very important because the contents of the stomach, which turns into chyme, is very acid. Again, the small intestine does not have a protective lining like the stomach does. So it squirts bicarbonate, which is secreted by the secretes bicarbonate, which will neutralize the contents of the stomach. And then it will also activate those enzymes that are coming from the pancreas, alkalize them, that will make them work. When we get through the small intestines, there's a junction called the ileocecal valve. The ileocecal valve is really important for colon hydrotherapy. I teach my students how to close that ileocecal valve because you really don't want that open during a colon hydrotherapy session. You don't want it going back into the small intestine. And I actually had somebody ask me about, well, do you do colon therapy and do you let it go up into the small intestine? And I said, absolutely not. We close that. And apparently there was somebody that practiced doing that in the Carolinas somewhere, but I was always taught to close that. And there's also, there's been some correlation with the ileocecal valve with low back pain and also nausea. And so that's been my experience working with people, because sometimes when they're on the table and there is some nausea, I always make sure that that ileocecal valve is closed, but it also can be because of the toxicity level that people have in their intestines. Then we come to the large intestine, which I feel is one of my favorite organs. And the large intestine is responsible for the absorption of nutrients and water and electrolytes. And of course, it's responsible for the elimination of waste. The large intestine has 4 layers, and it's a muscle, so it expands and it contracts. And your colon is as long as you are tall. And I've actually had clients that have had an extra 3 feet, 5 feet of colon. It's pretty amazing. I had a gentleman who was in his 80s, and his GI doctor had suggested that he get his colon, part of his colon removed. And he didn't want that. So he came to me for colon therapy treatments. And we did that for about a year. And I told him, I said, you know, sometimes we have to go ahead and move into allopathic medicine. I mean, there's a place for all of this working together. So after a year, he went ahead and he had like close to almost all the 5 feet removed, but he had an extra 5 feet. And after that, you know, he was doing pretty good. And then I had another client who had a roller coaster for a colon. I mean, it's absolutely amazing, the different shapes, and you'll see some of the shapes in the slides here, if it ever works, or in the booklet. And this lady had constipation, really bad, because actually she had extra footage in her colon, and it was wrapped around, going up and down and around. And her diet, she had really improved her diet quite a bit, and taking enzymes and following all these wonderful things, but it still wasn't working. So then she came to me for colon therapy. And so I told her, I said, well, let's see how we'll work this. And what I did with her was 3 treatments a week for about 3 weeks. And I would alternate the different temperatures of water. And then we'd go down to 2 times a week for about 2 weeks, once a week, and then I would go alternating weeks, and eventually 3, then once a month. And then within a matter of 6 months, she was having regular bowel movements. We were able to restore some of the tonicity in her colon. And I mean, that's really wonderful to hear about. So you'll hear some more little stories that I have working with the colonics.
I gotta change the
5 sections. It's the cecum, the ascending colon, the transverse, the descending, and the sigmoid. Now the cecum and the sigmoid area are where you're going to get a lot of cancers. A lot of times we have people that will have problems and build up actually in the cecum area and in the sigmoid area as well. And actually, we can't forget about the appendix. A lot of times people say that there's no value to the appendix. And there was a lady, Lee Dubell. Some of you may have heard of her before. She's actually had resided in Arizona back in the 70s and 80s. And she had stated that the appendix actually squirted out a germicide fluid that would kill parasites and bacteria. And she had said that 25% of people that didn't have their appendix would have a better chance of getting cancer. So just recently, while my husband was visiting his daughter in Virginia, he brought back an article that was in the Roanoke Times at the Duke University. They stated that the appendix, long thought to be a useless organ, actually grows and protects good germs for your gut. And that is something that's absolutely wonderful. I think that we're making slow strides here.
What number slide?
What number slide? 16? Thank you. So, they mentioned that good bacteria, and I'm sure many of you have heard about acidophilus and bifidus and the different strands that we have. Good bacteria is really important, as well as the bad bacteria in our intestines. We should have 80% good bacteria and 20% bad bacteria. And we need to keep that in check. The good bacteria will increase as you move down small intestine. And actually, most of the good bacteria resides in the large intestine. You have approximately 2 to 3 pounds of good bacteria in your large intestine. To visualize that, that's the size of a brick. And it's pretty amazing that we're carrying that much inside. And the good bacteria is so important because it helps to produce vitamin K and A. It also helps to produce vitamin B, which actually sends messages to the receptors in the colon for contractions. It helps to produce short-chain fatty acids, promoting 70% of energy needed by the intestinal epithelial cells. It may decrease cancer and also increases the acidity in the colon, limiting the population of pathogens. You have better absorption of your magnesium, calcium, and zinc. And also, Leonard Smith, who's a GI doctor, he just does consults now, and he works with my mentor, Brenda Watson. He had stated that if there's only one supplement you could take, it should be your probiotic. And Jeffrey Bland, who Dr. Boyd Haley had mentioned before, functional medicine, he states there are more bacteria in our intestinal tract than cells in our body. So it's really necessary to have good bacteria in our colons. And there'll be times that actually what I'll do is that, excuse me for a second, I looked over there and I got thrown off. Okay, stay there. Okay. There'll be times that I'll actually do implants during a colon hydrotherapy session. An implant is when you have a syringe with good water in it and you put in like a substance of either wheatgrass or the good bacteria, because you know that, or at least I know in Europe, that they do a lot of suppositories, and if you want something to get into your system quickly, you're going to go up the bum. And it's absorbed immediately. And I do, when I get a script from a doctor, I usually put a combination of wheatgrass and good bacteria, and you can feel a nice buzz go through your system. And actually, too, if you get gas, women get gas, men fart. So you can have a different aroma for that. So anyhow, and the Bristol part here is something that was developed back in 1997 at the University of Bristol in the UK. And the purpose of this was to have a general measurement to evaluate the consistency and form of stools. Because the stool, like I said,
can remain in the large intestine to an hour to days. And so what's really interesting about this now is that when you leave today, you'll know where you stand on this Bristol chart. So if you take a look at types 1 and 2, this is more for constipation. And if you have little balls that come out, I call them rabbit turds. If they're a little bit larger than their milk duds. And I actually call them that through my viewing tube, which you'll see the piece of equipment. Then you're constipated. And everybody says, well, you need to drink more water. But constipation is really more complicated than just water. You have to ask yourself, is there food sensitivities, allergies? Are the levels of bacteria good? What is the pH of the colon and, in fact, the body? And, of course, with acupuncture, too, what is the energy that's going through these meridians? Because all that can affect the large intestine. And also what can affect the large intestine are the neurotransmitters. And I believe that somebody's going to be talking about that today, or sometime during the weekend. Now, what we're really looking for, ideally, is 3 and 4. What does a good bowel movement look like? Well, it looks like a banana, but it's not yellow, hopefully. It should be like a walnut color and come out smoothly. Now, I don't say that a vegetarian diet is better than a meat diet because everybody's different. Everybody's body is different. So if you're more of a vegetarian, what will happen when your feces hits the water, it might start coming out smooth, but then you'll have a mud pie. But if you do eat meat, then your stool still might be nice and somewhat smooth, but it will sink. So 3 and 4 are your ideal things for your stool. When you get to 5 and 6, you're going to have some diarrhea. And it's going to be a little bit soft, a little bit mushy. And 7 and 8 is when you really have things just go right through you. I'm sure sometimes your patients might say to you, you know, after I get done with this and I eat, things just go right through me. And that's not good. We have people that actually, as soon as they get done eating, it's good to have a good bowel movement, but we want types 3 and 4. We don't want 7 and 8 to go through. And explosive stools, because that's an indication that something is not right somewhere in the intestinal tract. If for some reason you're really curious about your stool and you want to see what comes out and you see green in your stool, it might be because it's going through your system too quickly, or you might be eating a lot of vegetables, or what are the supplements that you're taking? And of course, for those of us that chew a lot thoroughly, or those of us that juice, what did you juice that day? And it's really interesting when I have somebody on the table and they haven't told me about what they ate that day, or they forgot something, all of a sudden I see like this orange color coming out, and I'm like, oh my gosh, what? I'm thinking, oh, is there something going on with the pancreas or something? And they said, oh no, I said, I had carrot juice today. I said, good, thank goodness. You know, or if their stool is very, very, very dark, because that could be pathology from the upper GI tract, or they're eating a lot of dark green vegetables, or a lot of meat.
Operation Bright.
It's white, or even sometimes in my pubic area of the hydrotherapy, if it's white, that could be an indication of there's some kidney problems or problems with the gallbladder. And when I find this out, I will usually say, you know, there might be something that you might need to look at, and I'll refer them to a holistic doctor in the area, and I encourage them to do that. Since I'm not supposed to diagnose, only suggest, I will refer them over to a doctor. If there's some white wrapped around, it could be mucus. A lot of times people will eat a lot of dairy, or you're not even too sure about some of the foods that are in this processed food that you're eating, and you'll see white wrapped around it. Sometimes I'll see white wrapped around it, and I actually sometimes see tapeworms come out of people. And if those of you who have read the book by Hilda Clark, cures for cancer, cures for all diseases, and the little flukes that come out, the little furry guys. I see those all the time coming out of people. So it's really like a heads up. If you see somebody with, at the studio is very yellow, ask them again, what are they eating? And it can also be that there's a concern with the large intestine, the lung, small intestine, and the stomach. So it's really important that we produce our enzymes, that we chew our food, and that our digestive tract is working really well. So impaired digestion, what happens with impaired digestion? Anybody here have stress in your life? Nobody. Hey, that's great. That's a wonderful that you don't have stress. Because there's good stress and there's bad stress. But when it's for prolonged periods of time, it can really affect our emotions, moving into fear, anxiety, and depression. And it can affect our stress hormones and can accelerate the movement of waste going through our body. Or sometimes if you're nervous about taking your flight and you're running to the bathroom 2 or 3 times, or if you're being a speaker at a convention or something and it's passing through your quickly, you're moving into fight or flight. And a short period of time, it's okay. But longer than that, it's not always that okay. But then there's another very interesting point too by Michael Gershon, who wrote the book, The Second Brain. That's an excellent book, and it talks about our neurotransmitters, that we actually have a brain separate from our brain up here, and that we have more neurotransmitters in our gut than we do in our brain. And what's really fascinating that I found that the gut's brain is in many nerve cells that are in the esophagus, stomach, small intestine, large intestines in the enteric nervous system, and there are 1 million nerve cells in the small intestine, a number equally the nerve cells in the spinal cord. That's pretty amazing, and that's just the small intestine. So when I have clients that come to me and they've been to these allopathic doctors saying that, oh, it's all in your head, well, little do they know that it's in their second brain. So we try and work with them and send them to somebody that might be working with neurotransmitters. There's a real good company called Neurosciences that works with them, and some of you might be familiar with that. You can always go online and look them up under neurosciences.com. An important thing too that you can do with your stress is take a vacation. I understand that this conference here started out as healing at sea. So let the water to not negative ions just kind of bathe your body in it and see how it works for you. It's not working. Except if you're an executive director or president of an organization, it never works. And processed food. We are always on the go. So what's in that processed food that we're eating? We've got additives. We've got white flour. We've got corn. We have all these things that are in our processed foods. How many of us actually take the time to bring food with us when we're working, take that break? But we're all healers. So what do healers do? They take care of everybody else first and then themselves. So it's really interesting. One thing that I came up with now that my brother's over 50.
Just there.
Oh, he's over 50. Anyhow, thing is, I have this little chart for myself and how we chronologically mature. It's a nice way of saying for aging. So when we're in our 40s, we're in our fabulous 40s, and when we're in our 50s, we're in our feisty 50s. When we're in our 60s, we're in our sexual 60s. When we're in our 70s, we're in our sensual 70s. When we're in our 80s, we're in our erotic 80s. Don't lose faith, because when you're 90, you're in your naughty 90s, and when you hit 100, life is wonderful. So take that attitude. It might help the neurotransmitters or the food going through your system. And it's just important to kind of take care of ourselves. And I know that I'm guilty of that because I'm always the last one to take care of myself. And the women out there right now, you've got your kids or you've got your grandchildren. It's
time to put ourselves forward. So for the first 50 years, you take care of everybody else. The next 50 years, I invite everybody here to take care of themselves first. It'd be a good thing to go. Some of the offices I know also have microwaves. Microwaves is killing your food. It's strongly suggested you don't use microwaves, even for water. I don't even own a microwave. I will not have one in my office. And I have many of my clients coming to me, well, how about using a microwave? No way. If I had one, I'd store food in it to keep, the air out and everything. Other than that, I would not use it at all. And in fact, in the Soviet Union, 1976, it was banned. In America, we are just kind of behind times. And I've had great opportunities here to talk to several gentlemen, in Europe. And I just wonder, we're so advanced in so many things, why are we so slow in everything else? Well, I guess Floyd Haley said it, we got a bunch of liars, the FDA there. So we need people like ourselves spreading the word to our patients and clients, saying, write your congressman, stand up, and let's get a voice. Excess inadequate chewing. I talked about that before. Inadequate chewing, what you really want to do is to make sure that you chew your food. You'd be surprised at the food that I see coming through the tube when I give people colonics. I ask them if I can recycle it. They can have their food used again. Excess food intake with meals. A lot of people will drink with their meals. I suggest that you don't drink with your meals because you dilute the digestive enzymes, and you don't want that. So I suggest if you have to drink with your meals, then just sip. I know that many of us take supplements during this time. We just take like 2 or 3 supplements and take a teaspoon of the sip and let it go down and rest a little bit. It's a really good idea. Improper food combining. Now this could be somewhat controversial because we have the food combining one way of eating. You've got the blood typing. You've got the Candida diet, you've got the raw food diet, and everybody always asks me, well, Suzanne, what should I do? And I said, well, first, begin with chewing your food and start basic. Because if you tell people to eat a certain way, they get all stressed out. And when you're all stressed out, you're going to throw your body off anyway. So I try to keep it really simple in the beginning and tell them simple food combining. Anything with the face on it, fish, turkey, cow. Don't mix it with the carbohydrate. Spaghetti and meatballs, your sandwiches. And if you have to do that, then just make sure that you take a lot of enzymes. Eat your fruit by itself. Eat your melons by itself. Try not to do too much dairy. And they always ask, well, don't I get my calcium from my dairy? I said, you get more calcium in your green vegetables than you do in your dairy. You don't need it. We don't have 4 stomachs like cows. So I suggest that you do more of that, or more of the green vegetables, or go ahead and switch over to rice milk or almond milk. I am not a firm believer in soy because soy is very different in this country. When I was in Japan teaching colon therapy, I had their tofu, I drank their soy, completely different. It actually had some taste to it. If you had some of the tofu and soy here, it's very, very bland. Overeating. Well, I know that probably, let's see, we have our birthdays that we overeat, we have Thanksgiving, there's Christmas and Hanukkah, and Easter and Passover, we overindulge. So try not to do that, or you know what you do, eat a little bit, go for a little walk, come back again, just space it out just a bit. And environmental. We have all this environmental toxicity, which I'll go over in a few minutes, that also affect our digestive system, and then medications. And we all know that what meds, we put so much stress on our liver. But it's also careful not to take too many enzymes to see if we can get some nutrients from our foods. And if you can, try and get organic foods. That's really important. And I have a lot of clients that can't afford that. So I tell them, intention is everything. And this might be a little bit airy-fairy for you, but we are more than just our bodies. We are this wonderful energy. And I just tell people, bless your food and may your body use it for its highest good. Okay, now we're going to look here at the different colons. The first one you see is a normal colon. Not too many people have that. The next one is a prolapse. That's the transverse colon, which is supposed to be about 2 inches above the umbilicus. And a lot of times you'll see people with very large stomachs. Their colons are probably prolapsed, and this can actually fall on the bladder, the uterus, also the prostate, and can cause incontinence. What I suggest for people is doing a slant board. You can go on a slant board, Google that, and get a slant board. Or I used to use an ironing board in my younger days and lean it against a chair with my feet up in a 45-degree angle, and I would lay back and do for about a minute or two, put my arms over my head, and then I would bring my legs up and do like a bicycle, and you can actually help it. The best time to do that is before you go to bed. So you do the slant board and hop into bed. We have the spasm, and nowadays you know that everybody loves to put labels on things. Spasm, IBS, irritable bowel syndrome, and you'll have a spasming in that. And what will happen is that the colon spasms, and so sometimes you'll have a stool that's real thin, and one that's very thin. And then we have a balloon sigmoid, and you'll also see on the sigmoid some pouches, and you have diverticuli. With the balloon sigmoid, a lot of times that will happen with women after childbirth because of pushing. And that can run into some problems with that. And I don't mean to get too graphic, but we're all into health here, but I actually had a client come in and said she had a terrible time eliminating because she felt like in her left quadrant, lower quadrant, she didn't feel like she eliminated all the time. And she had like 10 kids. My God bless her. And so she had problems with this elimination. And I actually had one of my clients tell me that if she would take her finger and push between the vaginal opening and the anus and push up, that would help the feces come out. Now, a thing that's really important too is that when you eliminate, you need to get a life step. And you can go to advancednaturals.com or brendanwatson.com and see these life steps. If they're like a little stool, it puts you in a natural squatting position. And what's really nice here on the cruise here, take that little garbage can, just put your feet on it. It puts you in a natural squatting position. And what happens is that you've got your nerve intervention from your lumbar area and sacral area sending messages to the colon, it's time to eliminate. So a good squatting position is really good for elimination. The diverticuli, which you see down at the bottom, is when a piece of fecal matter gets embedded inside the lining. And I have a great opportunity to work with 2 GI doctors where I can actually go in and see the colonoscopies. And you can see where there's been diverticuli in there and the hole in the colon wall. Colon therapy is very good for that to help clean it out. It would also be a wonderful idea, and I've had problems in trying to get the oxygen to do this, but to also use oxygen for that because it's very healing. Then in the second row to the right, we have the stricture. And this is where the colon will come like this and then comes in thinner and then broadens out again. And I had a lady come to me and her doctor wanted to do surgery because she had a kink in her colon. And she really didn't want to do this. And she said, please, will you help me? So I said, okay, I'll be more than happy to do this. I did 6 colonics on her. I told her after the 4th one, I really thought that she really needed to have the surgery, but she just begged me to work with her on that. After the 6th one, I told her, I said, the pain that I see you in, you really need to talk to your doctor, and you really do need to get a resection. Because it's just terrible to see people in this pain. This was an older woman. And And then about a month ago, I had a girl come in to me. Her girlfriend talked her into coming in for a colon therapy treatment because she had such great results with it. Well, she didn't tell me that she had an extra 3 feet of colon and that she had terrible IBS. We did the colon therapy treatment on her, and it was kind of painful for her. And she tells me that when she goes to the bathroom every day, she's in the bathroom 2 hours because she's got the IBS, she's got a kink in the colon, she's got a multiple of things. And this is, I mean, you hear this girl, I know, she was in the clinic, and I had tears coming down my eyes. I mean, because I could just feel the pain that she was in. And I told her, I gave her the name of the GI doctor that I work with. I said, you really need to think about having this resection. And she was only 23 years old. So why does this always happen? Sometimes it's congenital. I don't know all the reasons why it happened, but it just happens. And there are times, you know, we're all believers in not having to take meds or to have surgeries, but sometimes we have to take that step and have it done. So this is a digestive system, and you can see, here's the stomach. You've got the black, which is cancer. You can see here the appendix, small intestine. You're here. You've got the transverse, the splenic flexure, the descending, and a little bit here on the small intestine. That is cancer. You can see the different areas there where the colon has come together as a stricture and moves out again, and also where it's also ballooned. This is a sigmoid. This has 30 to 40 pounds of fecal matter in it. This is in the lower left quadrant of the body, the abdomen area. And there is also, there was another photo that I couldn't find and bring in. There was a gentleman who was a schizophrenic that was in a hospital. And I don't understand why they didn't give him enemas or something to relieve him. But his colon was 18 inches in diameter from cecum to anus. They had it out on the surgery table showing this. And the gentleman that was laying down, his abdomen had to at least extend upward at least a foot. So, now, talking a little bit about the metals, and a few facts about the metals is that around the 1700s or later part of it, we have the Industrial Revolution or the introduction of chemicals, and as Dr. Boyd Haley said, the Mad Hatter, and they actually used mercury in the manufacturing of these hats. So I guess being on the head, it kind of sucked through their skull and they went a little bit mad. And now, in 2005, the EPA says 4 billion chemicals released into the environment each year. So in about 250 years, that's we have all these chemicals in our environment. We also have the support of the National Cancer Society stating that environmental toxins are responsible 80 to 90% of all cancers. You know, we have to dig for this information. And then we also know, too, that the metal is 5 times denser than water. It's very difficult to destroy and get out of the body. And as Boyd Haley had said, too, is that it stays in the adipose tissue. Now, some of you, this is not just about metals. We talk about our environment. And earlier, what I have done is that some of you got a little strip of paper. And I want to show you that it's not just metals that affect our bodies. It's many other things. So I handed out some paper to people. And so I just got this book, and it was really interesting, and I really wanted to share it with everybody. Within every 24 hours, we may consume the following amounts of toxins in an average lifestyle. So the person who has number 1 on their sheet of paper, could you please read it?
Toxins from food, 325,000.
So 325,000 toxins from food. This is white flour, sugar in desserts, hormones, antibiotics, pesticides, fast food, MSM,
MSG.
Didn't stay there. Hydrogenated oils, processed foods, etc. Who's got number 2?
Toxins from beverages, 160,000.
160,000 from beverages. Well, what kind of beverages are those? Pasteurized milk, soft drinks, diet colas, sports drinks, juice concentrates, alcohol, refined sugars, artificial sweeteners and coloring that are in our beverages, and of course some of the water that we drink. Who's got number 3? Nobody has number 3? Then I'll say toxins from air, 200,000. This is from fossil fuels, smoke, chemtrail residue, paint fumes, air freshener, cleaning supplies. That's a lot of toxins. Who's got number 4?
Toxins from water, 150,000.
150,000 in our water. This includes fluorine, prescribed drug residue, pesticides, rocket fuel, bacteria, parasites. It's a lot of toxins. How about the next one? 6, I believe.
Toxins from prescription drugs, 180,000.
180,000 from prescription drugs. Aluminum, mercury, chemotherapy, leftover animal parts from meat, processing plants, synthetic chemicals, synthetic hormones, vaccines, the list goes on. And then the next one,
Toxins from microbes, parasites.
toxins from microbes, parasites, yeast, fungus, and worms.
525,000.
525,000. Think about that number, that's mighty large. Toxins, next one.
Number 7. Toxins from physical and emotional stress, 200,000.
200,000 from physical and emotional stress, depression, anxiety, fear, negative emotions. Think about our minds and what we think about. And then the next one,
Toxins from heavy metals, 130,000.
130,000. And we all saw that with Boyd in his talk today. And there's one more,
Toxins from radiation, cell damage and death, 230,000.
230,000 toxins. Microwave cooking, x-rays, fluorescent lighting, hair dryers. All these toxins that we don't even think about. They're in the air. They're in the food that we eat. They're in our cosmetics. We inhale it, ingest it, and absorb it. How many of you take your clothes to dry cleaners? Think about those chemicals. Ladies, how about all those the cosmetics that we wear? There's toxins in those. So there's poor digestion results in the retention of toxic metals in our system, and they accumulate faster in our body than we can get rid of them. So there's buildup in our toxins. They interfere with mineral balance, they disrupt normal metabolic processes, and decrease immune function. Dr. Bernard Jensen was a firm believer in colon hydrotherapy. He was a chiropractor. He cured himself from cancer a couple of times, and he lived to be in his early 90s. And I thought this was very a good way of stating what how our digestive system is really good and what's important about it. That every tissue is fed by the blood, which is supplied by the intestinal system. When the blood is dirty, so are the organs and the tissues. It is the intestinal system that has to be cared for before any effective healing can take place. And this is a toxic stress cycle by Stuart Wheelwright, who is a master herbalist. And he felt that the digestive system is where it is, and this is where it begins, and it goes to the colon. It's a domino effect of how the overload of toxins is passed from one organ system to another, and how the body deals with it, or chronic degeneration occurs. An improperly digested food becomes toxic in the colon. It overloads and congests the liver. It stresses and damages the kidney. The kidney fails to process the toxins, and the cycle continues through the other organ systems. And this is from his book, Liver Your Lifeline. And it's an excellent book. So you can see here that it affects all the organs. Overload of toxins pass from organ to organ, resulting in disease. Toxins produced in the bowel travel to the liver through the portal vein, and which we'll go over in a few minutes, but you can see how the venous system is connected to the bowel, going to the portal vein, up through the liver. Next. Our liver is really very important, as you well know. Also in Chinese medicine, they also feel that the liver, the colon, and the digestive duodenum part of the small intestine is really important in one's health. And in phase 1, the liver neutralizes the toxin. In phase 2, the liver sends toxins for elimination, either through the kidneys to the urine, or through the bile as it travels through the intestinal tract and eliminated through the bowel. And if it's not broken down properly, it's stored in the body and in fat. Now we're going to get into part colon therapy. Colon therapy has actually been around for a very long time. The Egyptians got the idea when they saw an ibex on the Nile, near the Nile River, and they took its beak with water and stuck it up its anus, and then pulled it out, and a lot of things came out. So of course, as humans like to do, we like to emulate things, so we thought we'd come up with something else. Fortunately, we don't use the boards that they used back then. We're a little bit more advanced nowadays. So we are now approved by the FDA. It's a medical device. And in Florida, we are the only state that is certified and licensed in colon hydrotherapy. We must be a massage therapist in order to do colon therapy. In other states, there are no legislation right now for that. However, through the International Association of Colon Hydrotherapy, we are now working with the state of Washington and California for legislation, and North Carolina. And we're hoping that other people in the other states will take movement into getting this certified or licensed, because colon therapy is vital to our health. It's very important. And we have 2 pieces of equipment, the open and closed system. This is a closed system, and what you can see that we have a temperature gauge to the far upper left. The middle is a pressure gauge, and then a timer. We have this red horizontal knob. It's the waste control. We can open and close the water as it goes in and out. And then we have a flow control where we can have the water going slowly, or we can have it go in a little bit faster. So if you're kind of pissed off at somebody, you don't like them having water go real fast, they'll get a big charge out of it. This is an open system. It's based on gravity. And inside that cabinet, you open it up, it's like a 5-gallon tank that's in there, and it works on gravity. This is where a person lays on the table, and they perform the procedure themselves. Then we have the enema. We have our little Fleets enema, and then you have the hot water bottle with the little rectal tube that you use. And this really only cleans like the sigmoid rectal area. It doesn't go around the entire colon. So with colon therapy, we have repeated infusion of water, can eliminate without getting up, can clean the entire colon through series of fills and empty cycles. But with an enema, it's one-time infusion. You're holding it, and it can be very uncomfortable, and you have to run and eliminate in the toilet, and it only cleans the rectal sigmoid area. And actually, in 1977, it was mentioned in the Merck manual that medications and nutrients, as you see here, were actually put in enemas. Enemas were actually used in hospitals. And then when prescription drugs came along, they kind of lost its use. So I'm going to explain to you a little bit about the colon hydrotherapy treatments and how they're different. In a closed system, we have draping. A person will come in, they fill out a history form, the therapist goes over with them. What they will have is a gown and a sheet over them at all times, so their trust and safety issues are addressed. We have a speculum. John, are you going to come up here and demonstrate?
I'll hold it for you.
Bend over, John.
It's the whole tube.
This is a speculum that's inserted into the rectum. And I know some of you might be saying, oh my gosh, that's so large, but actually your anus can open up as wide as your mouth. have the same types of muscles in that area.
Some are interchangeable.
Go prove it.
So, if you take a look at children's fecal matter, when they go, their bowel movements are very large. They don't have the emotional baggage that we have gotten as we've gotten chronologically mature. So what happens is that we insert the speculum into the rectum about this far. It doesn't go all the way up. The obturator comes out, and then we hook up our water line like this, and then our waistline. And then we'll infuse water into your system. When you get a full feeling, you let us know, and then the water will come out through our view area, which I call the BM TV. The channel doesn't change much. You have the same shitty characters, and that's the way that it is. We have a therapist in the room with you at all times. We do body work. We do sometimes craniosacral, visceral manipulation. At my clinic, I don't know the visceral manipulation, so I'm always knocking on my husband's door. You please release this, and he comes in and he'll help me out sometimes during the session. We do fluid reflexology, acupressure. Sometimes I'll do creative visualization with them. I'll do cranial work with them. But there's a relationship with the closed system, with the therapist, the piece of equipment, and the person you have on the table. Another very interesting thing when people are on the table is they're going through an emotional stress, divorce, or something's wrong with the kids. When they start talking about it, they start releasing. And you'll see stuff coming out that's unbelievable. There are several different manufacturers for the closed system. I like the Titello. I'm also a trainer for them. But this piece of equipment is the only piece of equipment that has been clinically proven. There was a test with the GI doctor up in Danbury, and we did a study on that, which should be published within the next month for preparation for colonoscopies, that people had great results getting colon therapy instead of having to drink that GoLightly. And so we're going to see more of that go on. It actually gives your colon a workout. With the closed system, you're isolating the large intestine. Water goes in. When a person gets a full feeling, you let the water out. And then that works with the colon by making it stronger, the musculature. We use warm water between 92 and 102. Sometimes I'll go down to 85 because I want to get that muscle working. I've had some people that have really low tonicity of the muscle, so I'll play with the water with that, with the colon. The sessions are usually 45 minutes. They're on the table, and the whole session is 60 minutes. Now there's another system out there, and actually I've had both systems in my clinic, and I prefer the closed system because I feel that it's a lot more friendlier. In an open system, their nozzle is a little bit different, and what happens, there is draping required. This is a nozzle that they have, that the client inserts themselves. Water is constantly going inside of them, and when they're full, then they push. And then the feces drops down into a basin, and it's vacuumed out. There's usually not a therapist in the room. However, I am finding out that there are some therapists that will stay in the room. It can be a little bit embarrassing for the person on the table because, if it's a girl, they have gas. If it's a man, they fart. So sometimes those sounds will be there. It's gravity fed. There's several manufacturers, and the time is also the same. It's really up to the individual what they want, but from my professional opinion, I do prefer the closed system. Colon therapy can benefit a lot. Body pain, I have people that come in with body pain, especially low back pain. After they have their colonic, they feel so much better. And instead of walking like this, they're walking upright. Fatigue, food allergies, digestive issues, and circulation. What I've done is that I consolidated my long list, and I made it smaller up here and it's longer in the booklet here. But we'll have people come in that are very low in energy, and they haven't had a bowel movement for 3 days. You can imagine, 3 days. So what happens? All that stuff is going back inside of them. When they come out of the treatment room, they're standing upright and they have energy. And I tell them, you might be tired because you have all those toxins stirred up in your system. And I tell them that you may consider having a colonic 3 between a 7 and 10 day period. Each person is different because
If they're having regular bowel movements, I'm not gonna have them come like 2 times a week. But if I have somebody that's come to me, and I have many that do, go 1 time in 10 days, I'll have them come 2 days in a row, and then maybe 4 days after. I always call my clients the day after they have their colon therapy treatment, because it's important to me to find out how are they feeling. If they have flu-like symptoms, that can happen. If they do, they need to come back in again, because there's something that's not moving through the system.
Can I ask a question?
Yes, ma'am.
As long as we're talking about mental health, I mean, I've done the purest thing. Years ago, I read Fit for Life, so I've done everything right in life and still couldn't go, okay? Dawn was working with me forever, and then she was like, okay, this is gonna do nothing. She's like, it didn't work, no. So she sends me for colonics, okay? I go for 5. I mean, I was like doubled over in pain. I mean, it just hurt my colon so bad that why did I didn't feel flu-like. I just...
You were in pain, probably your colon, and I have She's saying that she went to, she had problems with her colon, and that when she went for colon therapy, they did 5 sessions, and it was very uncomfortable for her. And the pain, and sometimes the colon isn't working. Sometimes the colon's not used to working like that. Did the person use hot and cold water with you? Do you recall?
I think it was warm. She didn't go from one to the other, but...
See, you know, you're going to have different levels of people and what they are. I've been doing colon therapy for about 14, 15 years. And what works for one person won't work for another. I'd be curious to know if you have leaky gut. I mean, there's so many questions I would be asking you.
Well, I was
You
going to
know?
say, like, when you were saying about the roller coaster colon or the
Have you-
too long one, how do you find out if you have that?
Well, you need to get a colonoscopy. Have you had one before?
I'm sure I have. I've been to every kind of doctor in the world, and nobody can ever find out why.
Yeah, well, what I'll do is I'll talk to you afterwards, okay? Because I know I can't.
Like when I was the purest thing, I got cancer. Then I got all my healthy thing, working out 2 hours a day. Now I have every
Okay, well, what I'll do,
autoimmune
and what's your
that there
name?
is.
What's your name?
Joint.
Jen, let me talk to you afterwards, okay? So colon therapy can also help in environmental toxicity, the low back pain, the weight issues. A lot of people that come to me and they have, they want to lose weight. I actually had a person that was doing that, and I kind of caught on to that. She was an overeater, and she would come in and want to do fasting for a week, and then she came to me like a month later, oh, I want to fast again. And I said, no way. So you want to be careful with that. It will help you lose weight because your digestive system is going to be working more. Colon therapy takes out the old. Out with the old, in with the new. Okay? It helps to remove all the harmful toxins. The body's rejuvenated. The toxic debris is removed. The colon will return to its natural shape. Will that happen all the time? No. It depends what age you are and what kind of condition your colon is, but it can help get stronger. It restores the pH to the body, it stimulates the immune system, it allows free passage of nutrients into the blood, and it prevents toxic absorption into the healthy mucosa. As you can see, there's a whole list of benefits here, and I'm just going to let you go ahead and read that on your own time here. Contraindications are really important to know. Advanced pregnancy, they usually say that you shouldn't have colonics during your first and last trimester, and we like to go by these guidelines. I've worked on a person during their whole pregnancy. She was a client of mine for 10 years and made her pregnancy a lot more comfortable, but you know, really, the first and third trimester, you want to be careful with that. Intestinal ulcers, any kind of inflammation with the colon, you do not want to do any colon hydrotherapy, colitis, diverticulitis. Abdominal surgery within a year, colorectal cancer, acute anemia, kidney insufficiency, which reminds me, I had a student that I was teaching, and he had 1 kidney. During his colonic session, he had to take his medication. He was only taking his kidney medication,
It came through every single day he had a colonic. It didn't break down. It's amazing. The ulcerated colitis, colon and rectal surgery within the past year, any GI hemorrhaging, suspected or perforation or severe hemorrhoids. How do you know if you have severe hemorrhoids? Believe me, you will know. I had somebody come in and she says, well, I've got hemorrhoids, but I don't know if they're severe. I said, honey, if you're standing up and walking, you don't have severe hemorrhoids. Cardiac disease, acute inflammatory pathologies of the colon. So, how many bowel movements should a person have? A person should have a bowel movement as many times as they eat. Eat 3 meals a day, you should eliminate 3 meals a day. Now, I'm not talking about little rabbit turds. I'm talking a nice, healthy bowel movement, 4 to maybe 7 inches, 2 inches in diameter, not these little rabbit turds. I have people come to, oh, well, I had my bowel movement today. I said, okay, describe it to me. How about that big around? We do their colonic, unbelievable what comes out of it. They'll release for 30 minutes, and then even after they get off into the bathroom and go, they're in there for another 15 minutes. So if you eat 3 meals a day for 365 days, and you have 1 bowel movement daily, where is it being stored, I ask you? Where are those other meals? So, you can kind of visualize what's going on. And the other thing, because when I work with people, I kind of pull from different philosophies. Ayurvedic, like a very Vata body's very, very thin, and they like heat and moisture. They lean towards constipation. And so I try and tell them, try and have more mucus type foods like okra, drink warm fluids, don't drink cold. And so there's a lot of considerations to look at when you're dealing with constipation or bowel problems. So what I'd like to do in closing with this is I have a little story for you. And it's called the gut feeling. One day the body's organs were having an argument as to which one was the most important. The brain was the first to gloat that without the body, it couldn't think for itself and would do something really stupid and die. The heart disagreed, saying that without blood pumping around the body, all the organs would suffocate from the lack of oxygen. But the lung said, oh yeah, I provide the air for the rest of you guys, so I'm most important. Well, the kidney said, without me, the body would be poisoned and it would die. And the stomach said, yeah, but you know what? Without me, the body wouldn't be nourished. While the organs were sitting there and arguing amongst themselves, the poor little gut finally chimed in. Hey, you guys, remember me? What about me? Don't you think I'm important? The organs just laughed and teased the poor little output device. You're just a hole, they said. There's nothing to you. And the poor little hole went into hiding. You all are me. I'm going to prove that I'm the most important organ, and I'm going to hide and not do anything about it. They all continued laughing and eventually settled down for the night. The next morning, the brain tried to wake up. The body didn't have enough energy to do so. The heart felt a bit heavy and the lungs were out of breath. The stomach said he felt pretty congested and bloated, while the kidneys complained that they couldn't even keep up with the garbage the body was producing. This went on for a few days until they remembered that slowly poor little gut. It was true, they exclaimed. The poor little hole had clammed itself up in shame and affected the entire body. Okay, we give up. You are the most important organ in the body. And with that, the little hole gave out a huge sigh of relief, and the body was regular again. So, you know, I love being a home therapist, and I'm glad my brother bit me on my ass. And I actually get to say that I authentically
work with assholes.
I want to thank my sister for that and tell you the difference between her and myself. The story actually goes, the brain said, I'm the boss of the body because I do all the thinking. The arms say, I do all the work. And the legs said, wait a minute, I take you to the job that you have to work at. And the heart says, I pump the blood. And the lungs say, I bring in all the oxygen. And the asshole speaks up and says, but I should be the commander of the body. And they all laughed. And so, the moral of the story basically comes down to this. You don't have to have a brain, you don't have to have a heart, you don't have to have an arm to be the boss. You just got to be the perfect asshole.
And we clean them out to help them be that way.
I want to thank you very much for putting up with the technical problems. We are going to take a half-hour break, a little longer, and we'll try to find out why the
AV person's here.
Oh, the AV person, why this is working and not working sometimes or whatever. We'll be back here at 3:25.